Hello friends, I am Ruchi Shivare, Assistant Professor, Kamla Nehru College of Pharmacy. Now, today we have to discuss the new topic, that is beta-lactamase inhibitor. The learning objectives of beta-lactamase inhibitor topic is, the student after completing the course of beta-lactamase antibiotic, the student will understand the connection between the structural feature, mechanism of action, and uses of the beta-lactamase inhibitors. They gain knowledge about the therapeutic uses of beta-lactamase inhibitors. For introduction of beta-lactamase inhibitor, at its name include beta-lactamase inhibitor, we have to know what is beta-lactamase. The beta-lactamase are a family of enzymes produced by many gram-positive and gram-negative bacteria that inactivate beta-lactam antibiotics by opening the beta-lactam ring. Different beta-lactamases differ in their substrate affinities. There are three inhibitors of this enzyme: galvanic acid, salbactam, and tazobactams. These are clinically used as a beta-lactamase inhibitors. Now, why beta-lactamase inhibitors are given in combination with beta-lactam antibiotics? The answer of this question is in behind for understanding the mechanism of action of beta-lactamase inhibitors. Before that, we have to understand what is the connection between beta-lactam antibiotics and beta-lactamase inhibitors. In the case of beta-lactam antibiotics, the beta-lactamase enzyme break down its catalyzes the hydrolysis of beta-lactam ring and convert beta-lactam antibiotic into the inactive compounds. But when we use in combination with beta-lactamase antibiotics and beta-lactamase inhibitor, they form a complex. This complex is effective of beta-lactamase to diminished. In this case, the beta-lactamase inhibitor diminish the activity of beta-lactamase to catalyze the beta-lactam antibiotic. So they enhance the activity of beta-lactam antibiotics. The examples for these are galvanic acid, isolated from Streptomyces calvigos. Galvanic acid is a progressive inhibitor. It binds beta-lactam in reversibly initially, but becomes covalent later. Its inhibition increases with the time. It indicates for respiratory tract, skin, soft tissue, and intra-abdominal infections. The next example is salbactam. Salbactam is again a beta-lactamase disabling agent. It is prepared by partial chemical synthesis from penicillins, 2-3 times less potent than galvanic acid. It has been combined with ampicillin for use against a beta-lactamase producing resistant strains. It used commonly in surgical infection and gonorrhea. The last example for beta-lactamase inhibitor is tazobactam. It has a little or no antibacterial activity. It is similar to salbactam. Its pharmacokinetic matches with piperacillin, with which it has been combined for use of severe infections like peritonitis, pelvic, urinary respiratory tract infection caused by the beta-lactamase producing bacilli. Thank you.